Hello, Dr. Law. My name is Jessica Roberts. This is my Assignment 1 presentation for agenda setting in Psych 6163 on July 28, 2024 for Yorkville University. As a student in the Master of Arts in Counseling Psychology program, I have found that understanding and applying the principles of CBT, such as agenda setting, is crucial for effective therapy. This assignment is helping me grasp the importance of establishing a clear agenda in therapeutic settings, a skill I will need to master as I move forward in my studies and future career. Reflecting on my academic journey, I realize how the principles of CBT have influenced my study habits. The structure and organization inherent, the CBT mirror the strategies I employ to manage my coursework and personal commitments. To ensure the effective use of time and maintain structure during CBT appointments, it is essential to establish a jointly agreed upon agenda at the start of each session. This approach helps prioritize concerns by their importance, keeps the client's attention focused on relevant issues, and involves them as active participants in the process. According to Kennerly and colleagues, 2017, this agenda-setting procedure should take no more than 5 minutes per session. As a student, I am learning the significance of setting an agenda not only in therapy but also in my academic and personal life. Organizing tasks and setting clear priorities helps me stay focused and achieve my goals more efficiently. In my coursework, I have noticed the value of prioritizing tasks. By categorizing responsibilities based on urgency and impact, I can maintain a balanced and productive routine, mirroring the prioritization process in CBT. For example, when I am faced with multiple deadlines, I prioritize my tasks based on their due dates and complexity, which helps me manage my time more effectively. During each appointment, we begin by assessing the patient's current mood, reviewing assignments, discussing key themes, and providing feedback throughout the session. Kennerly et al. 2017 emphasizes the importance of prioritizing topics based on factors such as danger, urgency, level of discomfort, significance, potential for change, relevance to skills, and whether the issue can be resolved without further treatment. It is critical to allocate appropriate time to each problem, considering these variables. Regularly summarizing key points can help keep the agenda on track and provide a natural break between topics. Summarizing key points is a technique I use in my studies to ensure I understand the material thoroughly and stay on track with my learning objectives. Kennerly et al. 2017 suggests that this structured approach enhances decision-making by focusing on treatment goals, session objectives, and therapeutic structure. Research by Ryam and colleagues 2022 indicates that even when accounting for factors like the strength of the therapeutic bond and the counselor's ability to set an agenda, the clinician's capacity to assign tasks accurately predicts success in cognitive therapy. Furthermore, Miller and McNaught, 2018, highlight that the emphasis CBT places on treatment and session goals, agenda setting, and structure can significantly benefit the decision-making process. From my perspective, the ability to assign tasks and set clear goals has been instrumental in my academic success. This experience reinforces the importance of these strategies in therapeutic settings. I have seen how setting clear goals helps me stay motivated and track my progress over time, ensuring that I am always moving towards my objectives. In Dr. Todd Grande's video from 2017 titled CBT Roleplay Setting an Agenda for a Counseling Session, the therapist demonstrates several crucial components of the cognitive behavioral therapy agenda setting process. The session begins with the therapist warmly welcoming Ashley, the client, and inquiring about her current emotions and mood. According to Dr. Grande, 2017, this approach helps assess Ashley's emotional state and effectively initiates the session. Welcoming clients warmly and checking in on their emotions are practices I look forward to incorporating into my future sessions as they help establish a supportive and open environment. This initial connection can set a positive tone for the entire session and foster a trusting relationship between the therapist and the client. One essential component of CBT highlighted in the video is the review of progress from previous sessions, particularly focusing on how Ashley's homework assignments have impacted her work life. This practice monitors client development and emphasizes the importance of homework and CBT. Dr. Grande, 2017, expertly guides Ashley in prioritizing her issues, a key aspect of CBT's structured and goal-oriented nature. Reflecting on progress is something I find valuable in my academic journey as well. It provides a sense of accomplishment and helps identify areas for improvement, much like the CBT approach. Regularly reviewing my progress keeps me aware of my strengths and the areas I need to focus on more, ensuring continuous personal and academic growth. To provide a comprehensive structure to the CBT session, the therapist follows 7 essential components of agenda setting. First, establishing the session's focus at the beginning ensures both the client and therapist are aligned in addressing immediate concerns effectively. In Dr. Grande's video, the therapist begins by asking Ashley about her current emotions and mood, helping set the session's focus. Second, reviewing progress from previous sessions is vital. This involves discussing any progress or setbacks since the last session, particularly focusing on homework assignments and their impact. Both videos demonstrate this by checking in on the client's progress, with Dr. Grande reviewing Ashley's homework assignments and their effect on her work life. Third, prioritizing issues by identifying and ranking their importance ensures that the most critical topics are covered first. Dr. Grande helps Ashley prioritize her schooling concerns, while the therapist in Quala Counseling Services guides Brett in identifying his most challenging moments of the week. Fourth, setting a session's goals identifies and defines specific aims for the session, providing a clear roadmap for what both the client and therapist intend to achieve. In both videos, the therapists set clear goals by focusing on specific issues, such as schooling for Ashley and the real-life application of CBT concepts for Brett. Fifth, assigning homework reinforces the session's work and encourages clients to apply new skills outside of counseling. Dr. Grande and the therapist in Quala Counseling Services both assign relevant homework tasks to their clients to support their progress. Sixth, summarizing key points regularly during the session helps keep the discussion on track and ensures understanding. This practice is highlighted in both videos, where therapists summarize the discussion and plan next steps. Seventh, providing feedback throughout the session helps clients understand their progress and areas needing improvement. Both therapists provide feedback throughout their sessions, reinforcing positive behaviors and addressing any issues. If schooling is identified as Ashley's primary concern, the therapist encourages her to elaborate on her related thoughts, emotions, and behaviors. Understanding these cognitive and emotional responses is fundamental to CBT. Additionally, planning new homework assignments relevant to the main issue demonstrates the counselor's commitment to continuity and consistency, which are all vital for skill development in CBT. The session concludes with a summary and a plan, ensuring it remains focused and aligned with Ashley's needs. The techniques used by the therapist in the video are excellent examples of CBT strategies, including the use of homework for progress tracking, structured agenda setting, and attention to both cognitive and behavioral aspects. The client-centered and empathetic approach facilitates open communication. To gain a more comprehensive understanding of Ashley's concerns, it would be beneficial to explore her emotions and thoughts further, particularly regarding her relationship and professional issues. Breaking down larger concerns into manageable tasks is a strategy I use to handle my academic workload. This method makes challenges less overwhelming and more achievable. In Koala Counseling Services 2017 video, the therapist effectively demonstrates cognitive behavioral therapy techniques during a counseling session. The therapist begins by connecting the current session to the previous one, ensuring continuity and client satisfaction while setting an agenda for the session. According to Koala Counseling Services 2017, this approach helps in assessing Brett's progress and emotional state using a scale to measure his emotions. Establishing the session's focus is critical for effective therapy. The session starts with a review of Brett's progress, setting a clear focus for the discussion. This initial step ensures that both the therapist and Brett are aligned on the session's objectives and can address immediate concerns effectively. Reviewing progress from previous sessions involves detailed discussions of Brett's application of CBT concepts in real-life situations. This practice not only monitors his development, but also emphasizes the practical application of therapy techniques outside the session. The counselor's client-centered approach emphasizes collaboration and encourages Brett's input, which is essential for forming a strong therapeutic relationship. Prioritizing issues is another critical component, as the therapist helps Brett identify and rank his most challenging moments of the week. This structured approach ensures that the most pressing concerns are addressed first, providing a clear path for the session. As the session progresses, the focus shifts to Brett's experiences over the week, particularly his application of CBT concepts in real-life situations. Setting session goals is pivotal in providing a clear roadmap for what the session aims to achieve. In this session, clear goals are established, focusing on practical and actionable strategies to enhance Brett's immediate life circumstances. This goal-setting process is vital for maintaining the session's direction and ensuring both the client and counselor have a mutual understanding of the desired outcomes. The therapist examines Brett's most challenging moments of the week, guiding him to identify the thoughts connected to these situations. Additionally, the therapist introduces the concept of behavioral activation to encourage Brett's participation in constructive activities. Assigning homework is an integral part of CBT, and in this session, homework involving behavioral activation and studying the five-factor model is assigned. This promotes skill development and encourages Brett to apply what he learns in therapy to his daily life. Summarizing key points throughout the session helps keep the discussion on track and ensures understanding. The therapist effectively summarizes the discussion and plans next steps, reinforcing the session's main points and maintaining continuity. Providing feedback is also critical, as constructive feedback supports Brett's progress and addresses any difficulties he may be experiencing. The session concludes with a clear and well-defined strategy, ensuring that Brett understands and agrees with the proposed plan. The therapist skillfully balances outlining the agenda for the current session while reviewing previous progress. The use of qualitative mood evaluation and real-world application of therapeutic methods is particularly commendable. To enhance the session further, a more in-depth exploration of Brett's emotional experiences would provide a comprehensive understanding of his difficulties. Overall, the video offers a strong example of CBT in practice, tailored to meet the unique needs and preferences of the client. When comparing the CBT approaches from the two videos, it's clear that each counseling style has distinct advantages and areas for improvement. In the first video, Dr. Grande 2015 effectively helps the client prioritize her problems, particularly emphasizing her education. This strategy, combined with the thoughtful incorporation of homework assignments addressing various aspects of the client's life, demonstrates a goal-oriented and well-organized session. However, the therapist could have further explored the client's emotions and thoughts regarding her relationship and work-related concerns for a more comprehensive understanding. I believe that a more holistic approach, considering both personal and professional aspects, can provide a deeper understanding of an individual's challenges. This insight can lead to more effective solutions and support. In my future practice, I aim to ensure that I consider all facets of my clients' lives to offer the most comprehensive care possible. In contrast, the therapist in the second session by Quella Counseling Services 2017 uses a measurable mood scale to objectively assess the client's emotional state, providing a clear way to monitor changes over time. The introduction of behavioral activation and the application of CBT concepts like the five-factor model to the client's real-life situations are particularly commendable. These practical and actionable strategies can significantly enhance the client's immediate life circumstances. However, similar to the first therapist, a deeper exploration of the client's emotional experiences, especially during his worst moments, could have been beneficial. Objective measures like mood scales can be incredibly useful in tracking progress. I've found that using similar tools in my daily life, such as mood journals, helps in identifying patterns and making informed decisions. By keeping track of my moods and triggers, I can better understand my emotional landscape and take proactive steps to manage my well-being. In my opinion, the approach used by the therapist in the second session is more appealing. The incorporation of behavioral activation, objective mood evaluation, and the practical application of therapeutic principles illustrate a comprehensive approach to CBT. This method effectively combines behavioral techniques with cognitive analysis. The therapeutic alliance is strengthened by focusing on client feedback and adopting a teamwork-oriented approach, both of which are crucial for positive counseling outcomes. In conclusion, while both therapists employ effective CBT methods, the second principles The second therapist's use of quantitative evaluations and the integration of both behavioral and cognitive therapies offer a more thorough and practical therapeutic approach. However, it's important to note that the efficacy of a counseling style can be highly individualized and may vary significantly based on the client's needs, preferences, and cultural diversity. Common agenda setting challenges in CBT include having an unspecific agenda, listing too many topics, lack of prioritization, addressing issues too quickly, insufficient genuine feedback from clients, misinterpreting problems, and jumping from one topic to another without reaching conclusions. According to Kennerly and colleagues, 2017, these issues can significantly hinder the effectiveness of therapy sessions. Waltman et al., 2017, identify frequent problems with clinical agenda setting skills, such as difficulty selecting sensible agenda items, stopping discussions, and sticking to the schedule. They argue that the lack of initial agenda or guidance often requires improvement in agenda setting procedures. Additionally, moving from a non-directive to a semi-structured approach presents a challenge, with new practitioners struggling to redirect and pause clients effectively. One common difficulty is creating an unspecific agenda, which new counselors might struggle with, leading to unfocused sessions. To address this, it's essential to practice setting clear, concise agendas with measurable goals. Utilizing templates or checklists can help ensure that all critical points are covered and that the session remains focused. Another challenge is prioritizing issues, especially when clients present multiple concerns. To tackle this, learning to categorize issues based on urgency and impact can be highly beneficial. Using decision-making frameworks can also aid in prioritizing effectively, ensuring that the most critical topics are addressed first. Interrupting clients can be particularly uncomfortable for new counselors, often leading to sessions that veer off track. Developing polite and effective ways to redirect conversations is very important. Practicing these techniques in role plays and seeking feedback from supervisors can help build confidence and ensure that sessions remain productive. Inexperienced clinicians often hold unfavorable benefits about interrupting their patients. Waltman and colleagues, 2017, note that even when instructors are prepared to politely stop patients who veer off topic or focus too much on CBT, establishing and maintaining a healthy agenda remains difficult. Furthermore, setting agendas can lead to issues with brief check-ins, lack of objectivity, and agendas that rarely translate into meeting objectives or results. While both therapists employ effective CBT methods, the second therapist's use of quantitative evaluations and the integration of both behavioral and cognitive therapies offer a more thorough and practical therapeutic approach. However, it's important to note that the efficacy of counseling style can be highly individualized and may vary significantly, as I mentioned before, based on the client's needs and preferences. Through my studies and experiences, I am learning that there is no one-size-fits-all approach in therapy. Flexibility and adaptation to individual needs are key to achieving the best outcomes. Thank you for listening. In summary, effective agenda setting in CBT requires overcoming various obstacles, including the development of structured and prioritized agendas, the ability to redirect conversations appropriately, and ensuring that session objectives are consistently met.